Hello, my name is Tyasia. I'm a rising junior at University of Pennsylvania. I'm studying neuroscience and hoping to minor in sociology, healthcare management, and chemistry. Um, how did I become interested in the healthcare field? First, I was interested in the healthcare field kind of from like a clinical, like wet lab translational research base setting. So when I come from a very low income, underinsured household, and when my mother was first diagnosed with MS, as well as having sickle cell, I was really interested in how this disease came about, the background of the disease, things like that. But it wasn't until I realized my mother was not receiving the treatment that she deserved. She was not receiving the attention that she deserved, and the hospitals were just basically not caring. So I was wondering, does this happen to other people? And it does happen to other people. Seeing these stats, seeing the maternal mortality rate, I saw all these problems and these struggles were disproportionately affecting specific communities. So I was really interested in researching why this happened. So when I came to Penn, at first, I just immersed myself in wet lab research. I thought that was what research was until I found one of my research mentors, Dr. Shauna Stites. She's not my research mentor for the program, but during the school year, and she really got me interested in more of that clinical research look. So I applied to SUMR and I was like, I'm really interested in public health and learning more about epidemiology. I was really interested in epidemiology. And so I applied to the program hoping, even though my background wasn't really too much public health based, since I was like a neuroscience major and only had some experience with wet lab and a little bit of experience with more clinical work, I was hoping they'd see how passionate I was, and thankfully they did. So I'm really interested in public health and health policy as well as healthcare management. And I'm hoping really to expand on my interest in health policy and public health, hopefully grow my interest as well. So beyond graduation, I hope to attend medical school as well as hopefully pursue a graduate degree, whether a master's or possibly a joint MD PhD program. I see my career really being focused on quality care and also improving interventions for some of these health disparities that disproportionately impact populations. So this kind of goes into a segue of what my projects are about this summer. So I'm partway SUMR and partway Gear Up. So my SUMR project is with Dr. Yehuda Martai, and I'm looking at the community health workers and how having a community health worker impacts the active cancer active treatment and survivorship of people with cancer. So we're really looking at comparing whether having a community health worker really does improve this cancer continuum and whether not having one doesn't. So this really interested me because I volunteer currently with the Center for Surgical Health as a personal patient navigator. And I was like, this is an amazing idea. I wish my family had the option of having a community health worker or a PPN. So yeah, I'm really interested in this intervention and improving care. My Gear Up project is on the biomarkers, specifically cancer antigen 125, and whether it is a fair biomarker for peritoneal cancer, whether the guideline for CA125 is too high for to be diagnosed with peritoneal cancer and go through with treatment. So I'm really interested in these projects. I'm learning more about the projects, and I can't wait till the symposium when I have more knowledge about my projects and I'm able to delve deep and ask even further questions about my projects. From this program, I hope to learn more about just my interest, I think, because I am so interested in an array of things. I remember hearing a talk from someone in implementation science, and I was like, wow, that's the greatest thing that I've ever heard. And I was so interested in it. But I really hope to kind of like pinpoint what I'm specifically interested in, the research side of things, and hopefully pursue more research in that field. So I think my awareness about health disparities in the US has helped me really navigate my interests. Specifically, just as I said before, like coming from a family that is lower income, and we've had the struggles of going to the doctor, but the doctor is saying straight to my family's face, you know, you're just seeking for drugs. You're not really asking for help, or going to the doctor and being misdiagnosed for years, and it leading to an evolving health problem that we now have to grapple with. I think all these experiences have allowed me to address these problems in a more empathetic route because of also experiencing these problems, but has also allowed me to grow on understanding other health disparities that are happening in the US, such as the Black maternal mortality rate and how low it is in comparison to white individuals and more. So I'm really excited for this program and to learn more about health policy, healthcare management, epidemiology. And yeah, I'm just so grateful to be able to experience this program. Joanna has been such a great help with connecting us to people who have the same interests as us and more. So